Ladies and gentlemen, we certainly appreciate your being here at the 41st Annual Cancer Control Society Convention, Labor Day weekend 2013 at the Sheraton Universal Hotel in Universal City. And part of the, I think the mission of the Cancer Control Society is to bring the clinic personnel, the people that, the doctors that actually treat cancer patients and have treated cancer patients for many years. And one of those, of course, is Dr. Gilberto Alvarez, over 35 years experience treating cancer patients in the Tijuana area. In spite of being just a very good physician, one of the first to integrate DMSO, Laetrile with the other protocols, one of the first to introduce hyperthermia, and one of the early physicians in Tijuana to utilize dendritic cell vaccines for the treatment of cancer and other conditions that warrant that. So he was the medical director of the Manor Clinic when Dr. Harold Manor was involved with the clinic before Dr. Manor died, and it's a real pleasure and honor to have Dr. Alvarez with us. Dr. Alvarez, thank you very much.
Thank you, Frank. Thank you for the nice introduction. Thank you very much. Well, I'll be speaking this time regarding our experience that we had developed for the last 35 years at the Stella Maris Clinic, where the subject is under Laetrile therapy, hyperthermia, and breast and brain tumors. So pretty much half of the presentation will be presented covering the basic therapy, mostly addressed for patients who happen to deal with a non-aggressive cancer behavior. The other half will be addressed to all those cases who relapse, those patients that either come at late stage or had been with a very aggressive cancer behavior. So I'm going to switch off the next slide, and we'll be talking about cellular stabilization, decreasing tumor cell resistance, biologic cancer weapons, and immunotherapy. And so the first area of cellular stabilization has to do with enhancing the cell functioning at all levels, at the digestive system, respiratory system, lymphatic system. And what we're doing here is preparing the body for the second part of the therapy, which is our natural cancer attacking system, and through immunomodulators. So we are to eliminate those tumor cell resistance, DNA mutation, protein code, and this protein code has been introduced by Dr. Ransberger in Germany, where he found that around the cell there's a protein code that really protects the cancer cell from being attacked by your own immune system or by other therapies. We are to detoxify our bodies as we keep exposed to the air pollution, environment, treated with chemos or radiation. These oxide radicals come into play. So the cell will not be functioning as we would like to. So we are emphasizing in cleansing the colon, introducing the action of the caffeine, which will be transported from the end part of the colon into the liver. And the caffeine, once we have it at the liver level, it will be squeezing your bile ducts. And at that point, we're bringing the bile, the pH of the bile, which is an alkaline pH, into the small intestines. And by doing so, we are automatically improving your intestinal absorption, where your enzymes, vitamins, nutrients will be better absorbed through our bodies. We are also exposed to these oxide radicals, where antioxidants play a very important role with selenium, beta-carotenes, IV ozone, alpha lipoic acid, and all these weapons to eliminate these oxide radicals. And ozone was pretty well documented by early speakers. Dr. Warburg, who found that the lack of oxygen plays an important role in how the cancer, how the cell may turn out into cancer cells. So, and this is pretty much influenced by the low oxygen level. So at the meantime, he introduced the action of the ozone, how ozone can destroy cancer cells, and not only that, ozone as well can fight virus, fungus, and bacteria, can improve the circulatory system, and can enhance the immune system. Now, as we get into the aging process, we get involved with atherosclerosis, where we don't get an ideal oxygen and energy delivery into the cell. So at this point, we are using chelation therapy through which we are creating a cleansing of the arterial circulatory system, where EDTA, DMSO, sodium alginate play a very important role. Now, we are, as other speakers had pretty much emphasized, we are to cut down the carbohydrates intake, fats, but not only that, we also are to eliminate the animal protein intake for one particular reason. As long as we keep eating animal protein, we will be using up our proteolytic enzymes. These proteolytic enzymes, ideally, we are to keep up in a high level for one purpose. These enzymes will be acting, these proteolytic enzymes, which are normally produced by the pancreas, will be acting, destroying the protein coat that surrounds these cancer cells. So at the center, we are representing the tumor cell surrounded by that protein coat. So this, it will be at this level where this proteolytic will be playing its role, eliminating that protein coat at the cancer level. On purpose, we're loading our patients with high enzyme intake supplements. The bottom line here is we are to take those enzymes at least 1 or 2 hours away from any solid food, mostly animal protein. The bottom line is that if we were to take these enzymes close to meals, they will be acting as digestive enzymes rather than providing you with that proteolytic action. So Dr. Wolf and eventually Dr. Karl Randberger in Germany, where I've been trained on enzyme therapy, made very important contributions in these regards. So we dilute the letrozole, ascorbic acid, and DMSO in an IV cocktail where Dr. Manner put his name. He claimed Dr. Manner cocktail, and he's the pioneer in this combination. Now, why we use letrozole, and how it works, and what about normal cells versus cancer cells? Letrozole will be is composed of 4 different molecules. 2 of the molecules contain glucose. A third molecule with benzaldehyde, which has the action to alleviate pain and also works as creating a well-being to the body, and carries also a short anti-tumor activity. The main action is provided by the hydrocyanic acid or cyanide. This is the one that really carries the anti-tumor activity. Now, why works on only cancer cells, and what about normal cells? This is explained by the presence of this enzyme called beta-glucosidase. And this enzyme is mostly present in cancer cells and is deficient in normal cells. So this is the enzyme in charge to break down this letrozole molecule, triggering the action of the cyanide into the cancer cell. Now, once we have that cyanide in the blood, how it works? It will be acting at this portion of the blood, the ferrous portion. So, which means that instead of carrying oxygen, we're carrying cyanide, and at this point we are shutting off the oxygen supply into the cell. So in spite of the fact that the cancer cells survive under low oxygen environment, we are shutting down that small portion of oxygen, and eventually this cancer cell will die. Another ingredient here, which is very important, has to do with dimethyl sulfoxide, or DMSO. Initially, it was introduced in Russia by Dr. I forgot the name at this moment, but anyway, it was used for veterinary purposes to alleviate joint conditions in cows and horses. Eventually, another practitioner from Oregon came up with the situation that DMSO was a very important transporter. So what it does, it